Thank you, Professor Clara Mavelia, for invitation to participate in this extremely relevant conference. I would like to start my speech by referring to two events of this month, that is November 2023. The first, Collins Dictionary has named artificial intelligence the word of the year in 2023. The second, this announcement coincided with the first day of the United Kingdom's Artificial Intelligence Safety Summit, where the United Kingdom, United States, European Union countries, and Australia and China have all agreed that artificial intelligence poses a potentially catastrophic risk to humanity. It was the first international declaration where they deal with the fast emerging technology. These two events manifest a controversy of extreme interest to artificial intelligence on the one hand, and fears about the consequences of its implementation in all spheres of human existence on the other hand. In my opinion, the vicissitudes of digitalization of the medical services in the conditions of war are the most obvious component of this controversy. Russia war against Ukraine, like the other wars in the world, showed that on the basis of the latest digital means, the nature of warfare is rapidly changing. Hence, ethics must keep pace with this change. This doesn't mean that the fundamental ethical questions have changed. This, in principle, war is inherently unethical. People need strong ethical reasons to justify it. The higher level of digitalization of the means of modern warfare poses a significant challenge to the theory of just war. As there are certain prerequisites for manipulation in determining who is the aggressor, who is the defender, and who is the victim. In my report, I will focus on the positive aspects of digitalization and the challenges associated with it, and I will talk about my vision of the perspectives in this field. Among the positive aspects is the timeliness of the implementation of the e-health program in Ukraine. This program covers the medical practice, management of medical institutions, medical law, information services for patients, and so on. For healthcare managers, e-health program should ensure management of the health industry, rational distribution and effective use of medical and financial resources of the state, create conditions for transparent competition in the market of medical services. In the first days of Russia's full-scale war against Ukraine, e-health program was extremely helpful. It made it possible to deal more quickly with the challenges of the medical field. Of course, the data security issues were among the top priorities during that time. Vladimir Kaminsky, director of the Medical Information System, ASKEP.net, which implements the National Program of Digital Transformation of the Healthcare System as a medical information system, noted that access to the system was closed to certain institutions of the Donetsk and Kherson regions in which there was a risk of leakage of personal and medical data, thanks to the fact that this system is cloud-based and all data is stored on remote services. Access to the system was closed for that institutions in a few clicks, and all data was saved. After deoccupation, access to them was restored just as quickly. Mr. Kaminsky also noted that a good trend in data security is that from now on, only those providers of medical systems that have a certificate of a comprehensive information protection system will work on the market. He emphasized also the role of financial and technological assistance from international healthcare organizations in implementing the project of digitalization of medical service in Ukraine. Analyzing the challenges and problems that arose and arise in the process of functioning of e-health, experts note various trends in increasing and decreasing user activity. Since the beginning of the war, when financial problems arose, institutions had the option not to enter data into the system. User activity dropped sharply in this period. Doctors have alternatively returned to paper records. The number of doctors using the system decreased by approximately 40%. However, in areas close to hostilities, the activity of doctors was above 90%. This testifies to the high level of moral responsibility of doctors who understood the importance of entering all data into the electronic system for their preservation. Unfortunately, we know that a large number of institutions have been completely or partially destroyed, but patients' medical data have been preserved, and patients can continue to receive qualified medical services in other cities of Ukraine and abroad. Another positive ethical trend today is the effort to respond to and improve the e-health system in the places where doctors most often visit it from mobile phones and tablets, to make it as simple and user-friendly as possible. In wartime conditions, medical companies are implementing services that enable communication with patients. They make it possible to download medical documents obtained in other medical institutions, and also to make an appointment not only for a doctor, but also for tests, ultrasounds, CT, MRI, and X-rays independently without visiting the contact center. Currently, new technological advances in the field of digital information, algorithmic forensic data analysis, autonomous surveillance, advanced robotics, and multispectral sensors are very essential for Ukraine. These digital technologies can reduce the impact of war on the civilian population and help rebuild war-ravaged medical facilities. Recently, acute ethical problems have arisen during the discussion of the legislative regulation of the protection of the gene pool of Ukraine by preserving the reproductive material of the defenders of Ukraine, both male and female, for state costs, namely artificial insemination as biological post-traumatic parenting. The draft law of the Verkhovna Rada of Ukraine number 8011 already adopted in the first reading. The first pilot projects began their work in Lviv and other Ukrainian cities. Advanced digital technologies are important tools in this field. Today, the digitalization is a global trend. For example, telemedicine makes it possible to improve the relationship between medical professionals and patients, as well as to offer cheaper, faster, and more effective solutions for the diagnosis and treatment of patients with various diseases. It is a very essential ethical fact that home doctor telemedicine systems work in the border villages of Zhytomyr region, Sumy region, and Chernihiv region, where there is a threat of active military operation. There is no doubt that in the field of modern healthcare, artificial intelligence is turning out to be fundamental. AI system can quickly sift through medical records, extracting important information from patient histories to treatment plans. This process, which could have taken hours by hand, now takes seconds. Healthcare professionals use voice recognition software integrated with artificial intelligence to transcribe patient encounters. This not only reduces paperwork, but also increases accuracy, leaving doctors more time to care for patients. AI can analyze text data, such as pathology reports and lab results, flagging abnormal values and patterns that may escape the human eye. This increases the chances of early detection and prompt intervention for treatment. In the conditions of war, artificial intelligence technologies play an important role in surgery and in the field of mental diseases. AI-guided robotic systems like the Da Vinci system can enhance surgical precision, minimize invasiveness, and improve patient outcomes in complex procedures. At the same time, we shouldn't forget about the indirect problems and challenges of artificial intelligence. Let me give one example. On August 5th, 2023, a military hospital and blood transfusion station were destroyed by a direct hit near a small city, Kupiansk, Kharkiv region. Vladislav Kateryna, a young, talented surgeon, a graduate of the Kharkiv National Medical University, was killed. Vladislav was an extraordinary personality. He decided to be a surgeon from childhood. He carefully studied and applied the latest digital technologies in surgery. But he and his patients were also destroyed by high precision digital means. A military hospital and blood transfusion station became a target for a high precision drone created on the basis of the latest digital technologies. Is this a fact of violation of the ethics of war? Can we consider this singular situation as a model of the universal threat that arises because of the discrepancy between humanity's goals to survive thanks to artificial intelligence and the intentions of certain social agents to dominate the world based on artificial intelligence without recognizing any social constraints? Or do we need to classify this situation as an accidental circumstance, like black medical humor says? We cured a patient from oncology, but he died of draft in the hospital room. In my opinion, the vicissitudes of the ethics of modern digitalization in the sphere of medical services depend on the adequate understanding and articulation of the problems of social responsibility. An interesting assumption arises in the analysis of data from Google search engine. For example, on November 21st, several days ago, it offered twice as much data on the ethics of business as on the topic of the ethics of war. Each of them is an aspect of social responsibility, but 648 million publications are devoted to the ethics of business and 345 million to the ethics of war. That is almost twice less. In the conditions of this threat of the Third World War, the threat of the use of nuclear weapons, such as disparity probably indicates that the theory of social responsibility doesn't correspond to modern challenges and threats. Of course, today there is a growing body of literature devoted to the ethical and legal aspects of the use of artificial intelligence for military purposes. With a dominant focus on the emergence of lethal autonomous weapons systems, this issue analyzed by an international research team consisting of Edward Hunter Christie, Amy Ayrton, Laurinas Adomaitis, and Matthias Klaus. This in-depth and multifaceted study allows us to conclude that those interested in expanding the scope of lethal autonomous weapons systems are more active, and the understanding of the necessary limitations and threats lags behind. Therefore, I would like to end my speech with what I started with. Digitalization expands the possibility of medical services, including in conditions of war, but optimism about these prospects must be socially responsible. The definitions of objects, agents, and means of digitalization must be balanced, restrained, and argued in the context of the ethics of good. In other words, the issue of the ethics of digitalization as the ethics of human survival should not be considered as the addition to the system of social responsibility, which is dominated by economic values and business profits. On the contrary, it should be the social responsibility in which the ethics of digitalization as a means of survival becomes a system-forming principle. Thank you for your attention.